Hello and welcome to episode 30 of the Dental Realist Podcast. I am Dr. Ryder Waldron, and as usual, I'm joined by Marcus D. Neff, DDS, and Troy Stevens, DDS. Marcus, how's it going tonight?
Well, I just got done a little while ago with a day helping out at the dental residency program at Idaho State. So now I'm home just relaxing and basking in the glory of dentistry.
Yeah. You're an educator. You are a man of many talents. And this is kind of nice to we don't usually record on a Friday afternoon. This is kind of weird, but it's kind of nice.
Change of pace.
Yeah. Troy, how's it going with you after a full week of dentistry?
Yes, and today I didn't do any dentistry, so it's even better.
And you're already feeling withdrawals.
Well, it's been a while since we podcasted, so it's good to get back on and chat about some stuff, and hopefully, get some more education out there for people.
Yeah, I think we've got some good topics tonight. It has been a while. We've had some dental conventions. We've been busy with normal life, and so we're back at it. But so this week, Troy had sent Marcus and I a study or an article that he read about a study from the ADA. So Troy, do you want to kind of recap what went on in this article and explain things to us, and then we can discuss?
Yeah. This just came across in the ADA Morning Huddle just a couple days ago. It was kind of an interesting article because, we've talked about stress before and things like that on the podcast. But this actually said, the title of this, and you could look it up on the ADA website, it says, "Dentists may detect chemo signals released by stressed patients." And they did a little study that showed that people wore these certain T-shirts, and they went out and they were stressed out about some stuff, whatever, and they put these T-shirts on mannequins and basically measured the stress level of the students that were working on a regular mannequin versus the ones that were wearing these stressed T-shirts, and found that the work was inferior on the stressed mannequins. So kind of interesting that there's like some sort of, maybe they're talking about like some chemo signals that we pick up as human beings that could potentially cause us to get stressed from our patients having stress. And that was kind of interesting to me, and so I passed that on to you guys, and we kind of discussed it just a little bit there. I mean, because we've talked about it in the past. How many times? I mean, when a patient is stressed out, I mean, you can feel it. That patient that tells you, "Hey, don't take this the wrong way, but I hate you."
Great way to start the appointment.
Those kind of things. And you and I, well, we've all talked about this before. Is that I have a hard time doing good work on them. It's almost like you just want to get them out of your chair as soon as absolutely possible, and maybe there's more to it than we initially drawn in. I mean, I'm not saying for sure. I'm sure they got to do more studies on this stuff, but I just found it was interesting that you could pick up on that.
It always feels like the patient that's the most nervous and that is the most anxious when they come in, that's the one that things go wrong on, right? It just seems like that's the patient where nothing goes right, where they come back a week later and their tooth hurts or something is, the part of the filling broke. Or it's like, how does it always happen to that person? But maybe there's something to it.
Yeah.
Yeah, that makes total sense. And I think we were just talking about this week or last week or something about how the people that come in and act all wound up and tell us how much they hate us and stuff. Yeah, it doesn't make for a good experience for either one of you. And now, I mean, that makes total sense to me if they're emitting some sort of chemical signal that tells us they're stressed. But another thing that I picked up from this study was they were wearing worn shirts from other stressed out people. That seems kind of disgusting.
Yeah.
But I guess all in the name of science. I don't know. But
apparently
that was really
shirts pick up the chemoreceptors, and even just having the shirt on this mannequin caused them to trigger that. Yeah, it's kind of interesting.
I mean, that is amazing because it does seem like that always happens. I mean, even if it's a kid or an adult. I did a pulpotomy on a kid last week, and they aren't the most fun. I mean, maybe pediatric dentists like them, but they aren't the most fun thing to do. The kid was great, though. She just laid there, let me numb her up, didn't move, and everything went fine. She came back a week later for a couple other fillings. Everything was feeling fine. But the kids that are flopping around and stressed out and crying, and mom and dad are holding them and everything like that. It's just like you can just feel the stress in the room, and it just does not make for a good environment to do dentistry, is how I feel.
Yep, absolutely. Yeah. And there may be something more to it, that we're detecting just as human beings than maybe meets the eye. Like this, like they're talking about stuff, what the heck could be admitted into a shirt that could cause stress, It almost sounds like voodoo.
Somebody's sweaty BO.
Right?
Sometimes dentistry is voodoo, so it makes sense.
Correct. It's like you could do a little filling on somebody, just a little tiny thing, barely even into the dentin, and it just absolutely lights them up. The next person, you could do a near pulp cap type filling, and feels great, doc. Doesn't even feel like you did anything.
Yeah. Well, and how many times have we talked about these root canals that we've seen from 20 or 30 years ago? And it looks like they took just a straight pin and slammed it down into those canals.
That's Silver Point.
Yeah, silver. I mean, And I've seen some that are out the apex. I've seen some that, on a molar that maybe have a couple of canals filled, but they definitely all are not filled. And you ask the patient about it, and it feels fine. No problem at all. And then we can do the most beautiful root canal ever, and they're like, oh, yeah, I can still fill something up there. I don't know. Yeah. I don't know what it is.
Yeah. It's dental voodoo.
It is. Okay, you guys want to move on to this email we got a few weeks ago?
Let's do it.
Does that sound okay? Okay. So I'm going to read through this, and we'll kind of, you guys stop me if you hear anything that you want to comment on, and then if not, we'll talk about it after. But this is from just a listener. We're not going to give their name at all. It says, first of all, I love your podcast. That's in capital letters, ! We thank you for that. It is pure therapy to me. There are many issues and annoyances in dentistry that only other dentists can relate to, and it's truly comforting to hear those topics discussed on your show and know that I am not alone in this. Also, your sense of humor always makes me laugh out loud. Yeah, we are pretty funny.
Yes.
Which is great. Since
we crack ourselves up all the time.
Yeah, we make ourselves laugh all the time. Which is great, since during the workday I rarely have anything to laugh about. I would really appreciate if I could get your opinions on this issue. This listener says, I just graduated last year and am currently an associate at a private practice. The practice consists of the owner dentist, me, and a hygienist. At first, the owner dentist seemed really nurturing and willing to mentor. So even though I knew from the start she was micromanaging, I took it as mentoring and gladly accepted and appreciated her efforts. However, lately it's getting unbearable. It seems like nothing I do is ever right. She interferes with what materials I use, how to write my notes, and nitpicks at them, and I feel that it's damned if I do and damned if I don't with her. She never admits her own fault, and if there's a problem, she would push it back on me. It's demoralizing. I think she also micromanages other people in the office. I'm thinking maybe it's because I'm not bringing as much cash as she had hoped when she first hired me. She had assured me that I would have enough patients to see before I signed the contract. However, once I started, let me find out where I am now. However, once I started, my schedule was pretty empty, and she started to push me to get more involved with the community. It's a very small town where I'm not from and don't know anyone. I have paid hundreds of dollars out of my own paycheck to sponsor and get involved. My schedule got a bit better after I finally volunteered to cut back to 4 days a week. I am definitely willing to learn and welcome constructive criticism. However, my question is, how do you know when enough is enough? I heard that it's common for new associates to be treated like crap, but is this normal? With all these issues, is it time to leave, or is this just part of being an associate? Thank you so much for your time, and I'm very looking forward to the next episode. So, okay, guys, this I don't know. This could be a common theme with a lot of new dentists. Marcus, you, I think, have a unique perspective on this because you, in the last few years, were working at another office and were basically treated like crap. Isn't that right?
Yeah, that's true. I went from having a solo practice to being an associate, basically working for somebody in a different office. And it was, yeah, the first little bit, it seemed like it was going to be just great. Everything seemed really good. And then it was just nonstop questioning everything I suggested, anything I did. It wasn't quite like the old guy did it, or the current old guy. He was still working there, That's not how he does it. And I mean, it got maddening to where it just became unworkable. So I don't know. I don't think that's always the case, but I've definitely been there.
Yeah, and Troy, you've had an associate work for you. Did you ever get to the point where you felt like you needed to micromanage or suggest materials or things like that beyond just the normal mentoring part of it?
No. See, I was an associate for a year before I bought into the practice I own now. The way that the gentleman that I bought into, they didn't tell me anything. I mean, as far as what I needed to do, anything. They just handed me patients. And then so I've had 5 or 6 associates over the years. And so we did the same thing with them. We never really micromanaged. They used the materials that we did. We asked them to do that. And for the most part, most of the associates were totally fine with that. But this is, I think my situation is atypical. Because if you talk to people, like Marcus just gave his experience, I believe I think we are the exception. I don't think that happens all the time. I think it's more of a controlled nature. I think in dentistry, solo dentists get so stuck on the way that they do things that they simply cannot comprehend anybody doing it any different.
Yeah.
And I think that then when they have an associate come in, even though they may think it's a great idea, they can't stand it. They can't stand somebody else having a different opinion. That whole adage that, if you ask 7 dentists, their opinion, you're going to get 7 different opinions.
Yeah.
And
yeah,
so
it's true.
if you don't find somebody that is flexible with that and can accept that there are differences, I think you're just going to sit and smash your head against the wall the whole time.
Yeah. Yeah, one thing I found interesting from this email was that this associate felt like it was their job to bring in new patients. So in this situation, whose job do you guys feel like, whose responsibility is it to bring in the new patients? Is it the associate? Is it the owner dentist? Is it, who is it? Marcus, what do you think?
Yeah, I mean, I think if you're coming in as an associate initially, especially for the first quite a while, I mean, I would assume that you're basically relying on the person who's employing you to have the patients there, because you likely have limited connections to people in the community. Unless you're going back to like your hometown where everybody knows you and remembers you, you probably are going to rely mostly on whoever you're working for to provide you with patients. Over time, I would expect that you should be expected to get out, meet people, get involved in whatever community you're in. People get to know you. The practice does some marketing to let people know you're there, that kind of thing. The way you interact with the patients you're seeing helps them feel comfortable referring family and friends, that kind of thing. But for the first while, I mean, I would guess at least 6 months or maybe longer, you're going to be at the mercy of wherever you're working.
Mm-hmm. Yeah. Why? My question would be, my question to this question would be something like, why did she bring an associate on in the first place? You know, was it, okay, I'm going to bring an associate in, and then that associate's going to come in and bring in new patients? Well, they clearly stated they weren't from that area. So how come would we just assume that a dentist is going to bring patients with them when they're first out of school? They don't know anybody. They're just learning. I mean, it sounds to me like maybe the owner didn't think it through. And brought an associate in and thought maybe that would build the practice. I mean, if the practice is so busy that it needs an associate, there should be no problem with busyness.
Yeah, I think so
me.
too. That's what I thought too. I couldn't imagine hiring an associate and expecting them to bring in patients. I mean, if you don't have the patient base to keep an associate busy, why hire one? If you're swamped and need an associate, then they should already be busy enough. But that should have been a discussion probably at the interview, and I don't know, I don't know whose fault that would be, but I would think most of the burden falls on the owner dentist as far as marketing and bringing in patients and keeping the new associate busy at first, and then it's up to the associate to probably diagnose treatment that they're seeing on the recall patients and go from there. But that's
another thing. Oh, sorry, Marcus, I cut you off.
Oh no, I was just gonna say, speaking from my own experience, I was in a position where I kind of needed to move into this, do this associateship, and in the needing to do that and kind of the excitement of, oh great, here's a good opportunity, I didn't ask nearly enough questions. I mean, I didn't dig enough. I didn't ask enough questions, I think, to really get a good good handle on what the dynamics really were going to be in this practice that I went into. And I would encourage anybody who's going in, I mean, whether you're just getting out of school and you're like, man, I need this job, I got to get going and working, or whatever the case is, just really, really be careful and ask lots of questions. Dig a little deeper. It'll be worth it and save you some headaches.
Yeah, so, well, that brings up a good question. What questions would you guys ask if you were the associate getting hired on at a new dentist, or at a new office with an owner dentist? Because with the student debt nowadays, most new graduates are going to work for somebody or at a corporate office. So, Troy, what would be some of the first questions you would ask if you were sitting down to this interview?
I would ask, do you have enough patience to keep me busy? I mean, that's a
no-brainer.
And then ask him to prove it. I mean, show me some numbers for the last 6 months.
Yep. Another thing is the owner dentist has to be okay with letting an associate see their patients, like you were saying, Ryder. If they are swamped, and they want somebody to come in to help alleviate their burden, lighten their load, you've got to be okay with being able to have other people see your patients. And sometimes that's not so easy, You kind of take it as a personal jab when the patient doesn't say, hey, I want to see, Dr. Stevens or Dr. Neff or Dr. Waldron. They want to see somebody else here. But one of those things, that kind of concerns me.
So, Marcus, what else would you want to ask the owner dentist that you were getting interviewed here?
I'd ask what procedures do you expect me to do? Because I think they should expect that you're going to be able to do basic dentistry, a filling, a crown, maybe a simple extraction. But it's good to ask those questions because maybe in their mind they're thinking, well, I want this guy to come in and do all the oral surgery because that's the crap I don't want to do, and I want to do all the molar endo. And maybe you aren't competent doing that. Maybe you didn't do a lot of that in dental school, or maybe you just, wherever you're at in your career, that's not something you've done a lot of, you don't like, you're not comfortable with. Well, that's going to lead to some problems if they keep putting that stuff in your schedule and you don't like doing it, or you're not very good at it, and the patients keep coming back with complications. So I'd ask, what is it you want me to do? What are the procedures I'm expected to do?
Let's talk about Marcus's wonderful experience with that when he came out of school.
Oh, with the endo?
Endo number 2. Do you remember that?
Oh my gosh, yeah, that was. It was, if it wasn't the first day, it was like one of the very first days. I'm working in a guy's office because I'd done a startup, and he loved endo. He actually went on and went back to school to become an endodontist. So they just assumed that's how everybody was. So, and that I would know how to do it. So in my column, I've got tooth number 2 for an endo on a tooth where the crown is off. The crown came off, and of course I part of it's me being an idiot and not just speaking up and saying I can't do that, and part of it's pride or whatever. But I got in there and kind of accessed it. I managed to find a pulp chamber. I can't even remember if I was able to keep a rubber dam on there. I had to call the other guy over like multiple times, and in the end, he basically ended up doing the whole thing, which was, I'm sure, a hassle for him because he was with other patients. I'm feeling embarrassed and stupid. Now the staff doesn't feel very confident in me, so yeah, it was not good.
Yep. So that's a great question to ask.
Yeah, that is a great question because, I think in a lot of job interviews, you may kind of exaggerate your skills, say you're willing to do anything. But in dentistry, it's a little bit different because if you're not willing to do everything, don't say you're willing to do everything, because you get into a messy extraction or like an endo like that, like it is a confidence killer and it causes stress. And, maybe finding a different practice where they don't expect you to do a lot of specialty dentistry would be a lot easier, or if they're okay with you referring stuff out, because I have heard a lot of that with owner dentists bringing in a new associate. It's because they want them to do the stuff they don't like to do, but maybe it's stuff that a lot of dentists don't like to do.
Right.
Yep.
I don't know. Yeah, I don't know. Well, Marcus, what made you finally decide to leave that office where you were working as an associate?
It got to the point where there were just so many different things that we were butting heads over, and I was miserable. I wasn't enjoying it. I'd find every reason I could to not be there. When I was there, they didn't like me. so they weren't scheduling much for me. So
it's hard to believe that anybody would like Dr.
It's
Neff.
hard to believe.
Well,
because if you know Marcus, to know Marcus is to love Marcus.
Absolutely.
And so,
Absolutely.
Anyway,
but my
go on,
schedule
Marcus.
was getting to where I wasn't busy, and I was getting paid off production, and so it was like I needed to move on, and it was kind of like them saying, "Hey, I guess if you want to just sit here and do nothing, we'll let you sit here and do nothing." But and fortunately, I had something come up that was available, and I thought at the time, oh, this will just be a temporary thing, and it's where I'm working now, and it's actually turned out to be a good fit for me. Something I never would have thought I'd do. Community health center is where I work now.
Yeah. So I would say the moral to that story is that don't just suffer through a job you hate, because the sooner you move on, the sooner you can probably find something better.
Yeah, and it wasn't easy. I mean, it was miserable there, and I was pretty stressed, not knowing exactly how this was all going to work out for a good 6 months to a year.
Yeah, so I think before you leave, you should probably have another job lined up. I mean, I don't know. I've never signed an associate contract, so I don't know if there's like you have to work here for 2 years, and if you break the contract, there's some, I don't know, financial penalty or something like that. But I guess make sure you know what you're getting into beforehand, and maybe even ask the dentist if you could work there a few days as like an independent contractor or something to see how the schedule is, see what kind of patients you have. I know whenever I hire like an assistant or a hygienist, I do like a working interview with them, and to make sure I like how they, keep the flow of the office going and can interact well with patients and the other staff. But I read this email and I think this is just like a miserable situation to be in. I don't know.
Yeah.
I think I would ask, if there's a guaranteed pay, if my schedule's not busy enough, am I going to get paid, I don't know, $500 a day or something like that, even if I don't do anything? Because, it's that, or go out and find a different job, because there's no sense sitting around not doing dentistry. There's too much student debt to pay back, and you got to get working right out of the gate. Man.
Yep.
Yeah. So
Sure.
I don't know. What do you guys think? What do you think for this listener? When do you think enough is enough, or has there been enough? Is it time for this person to leave? Troy, what do you think?
Yeah, I believe that there is. It doesn't sound like she's in a situation, or he or she, I can't remember who it was, but in a situation that's going to get any better. And therefore, dentistry is hard enough as it is, just doing dentistry when you and your staff are getting along.
Yeah.
For having the extra stress of not liking where you're working, what you're doing, that's no way would I ever put up with that for any length of time.
Yeah.
You just can't. I mean, you guys, we talked about it how many times on this podcast, and we always talk about it, but dentistry's stressful enough. You got to be able to at least go into work and not feel the stress of going, man, I really don't want to be here.
It's true. It's true.
And if you're in any kind of debt like I have been, you're going to be in dentistry for a long time.
Yeah.
I mean, it's been we're hitting the 15-year mark right now.
Yeah, it is true.
Yeah,
We've been graduated over 15 years, and there's still I can almost see a light at the end of the tunnel. Not quite, and I've been doing it for 15 years.
Yeah, that's true, because at this point, and we've talked about this before, at this point in our careers, we thought it would be smooth sailing. We just walk in and the dentistry does itself. We don't even have to do much. It's low stress. We've got the
Patients
staff we
pay their
want.
bills, and insurances just cover everything.
Yeah, and it's definitely not like that. So a big reason we did this podcast is to open some people's eyes that it's still stressful even 15 years in, and nowadays the student debt has doubled since we got out of school, which is, well, for some people that we know of, it's more than quintupled. But, it's just, the debt is unreal. So you've got to be working, and it's stressful enough to do dentistry. You've got to have at least people you work with or an office you enjoy working in. So, yeah, this is a tough situation for this emailer. All right, guys. Well, let's talk about some of this student debt, because we read an article this week in the Wall Street Journal that talked about a former dental student. He's an orthodontist now that is over $1 million in debt from student loans. He went to USC, which is a very expensive private school. He did that for dental school and for ortho school, And one of the quotes in here is that he thought, going there would be prestigious because it's a good school and things like that. Troy, besides shooting your blood pressure up, what did you get from this article?
I think just like Marcus said, it's interesting that here we are 15 years later, and I believe this guy may have had the same mentality that was programmed into us. Is that, don't worry about the debt that you're going to go into, because when you get out, you're going to make plenty of money, you're going to be able to cover it, and all that fun stuff. And basically one of the things that it says in here is it talks about how he's paying, this is $1 million.
It's $1 million.
That's insane, okay? And he's paying $1,500 a month, $1,589.97 a month for his debt. I pay about that, and I have like a fifth of the debt that he has.
Right. And
mine actually is ticking off, and it's still not going away very fast. But to pay that, it says in here, he's not even covering the interest. Mm-hmm. So every month he pays $1,500, he's going further into debt. Because over time it will accrue, and it'll come back to bite him. I just find that simply insane that and this is one of the reasons we started this podcast as well, is we've got to get people thinking about the debt. The debt is absolutely real. You cannot pay this stuff off quickly unless you come from a very wealthy family, or you are lucky enough to get into a practice that is just making tons of cash, which, we make cash, but it's tons and tons of cash. You got to make a lot more money than I ever expected you had to make to be able to get out of the debt quick. And this guy, I feel bad for him. I don't know how you'll ever get out of that debt.
I don't know either, because it says the interest rate is 6.8%. That's over double what we pay on ours. And it's, we haven't even made much of a dent in ours in 15 years. And there was a quote from the dean of the USC Dental School that says, you cannot decide you're just not raising tuition, because apparently tuition goes up 6% every year there. He goes on to say, everything that drives the operation, from salary raises to any other additional costs, have to come for the most part from tuition. Now,
salary raises? Hold on. Are the dental school people getting salary raises? Because I'm not.
Right. And we've talked about this, that with suppliers, how many suppliers are out there, and their fees, their prices go up on supplies about every 6 months, to be honest. Lab fees, they go up every year. Insurance reimbursements, they go down, and our pay goes down. But these people that think, they don't think, they actually are making money off of our dental education. They keep raising their fees because they know, in a way, we've got to pay it. But at some point, there's going to be a breaking point where dentists can't afford to use the best labs or the most expensive labs, the most expensive suppliers, and there's going to come a real tipping point. The other thing I think of is that, patients, they want to pay less. Some of them don't want to pay anything, but yet they want world-class dentistry delivered to them. Well, if they, expect the best labs, but they want to pay less, at some point we're going to have to start using other labs, and I don't know if the materials will be that good. I get it that the burden is on us to use the materials that are acceptable to be used in the mouth and work well, but there's going to come a point where things we're going to have to get real honest about things, and it's not going to go well for patients or for anybody else in the dental industry. So I don't know.
Well, you remember when we had Brian Trechek on, who's the dean of admissions of our school, we asked him that question. We says, where's the breaking point? Have we seen it yet? What point, how much debt does a student have to go into before they say, no, dentistry isn't worth it? And he says they still have no problem filling classes. They have applications coming out of their ears. So it's still a thing where, and here we are 15 years into it, it's not changed since we did. It goes back to that one little thing, kind of going back about dental anxiety and stress and stuff like that. Remember that, what you sent that writer today, last week, that little quote from that guy says he's, in my 40 years of dentistry, it doesn't seem like much progress has been made in reducing dental anxiety.
Yes. Yeah.
Dental patients are still looking for the perfect dental experience. No pain, no anesthetic, no opening their mouths, and no cost. And it goes for dental students as well. We're sitting here 15 years into it, and it seems like it doesn't matter how much debt you're going to go into. You're still going to do it.
Yeah.
Nothing has changed.
And the ADA is okay with more dental students getting accepted to school. I mean, our dental school, when we went to Marquette, they've gone from 75 when we were there up to 100. And you figure out, I don't know what the tuition is, $350,000 for those four years. I mean, that's a whole lot of money. And the ADA, when they get out of school, they're pushing, you got to join the ADA. You got to have the ADA at your back. Well, they want those extra dues every year. So the more dental students, the more dental graduates, the better it is for the ADA money-wise. And at some point, there is a breaking point. And, obviously, you get $1 million in debt. It's not all the dental school's fault. But, I think if you read this article that you'll realize that maybe he made some bad financial decisions. We've had people ask us which dental school to go to, and I think you go to the cheapest dental school as long as it's like an American accredited good, school with a good reputation. Because I don't know about you guys, but the only time I've ever had anybody ask me where I went to dental school is just out of pure curiosity. I've never had anybody ask me on an application or anything like that. So, I just don't think that matters. If you're licensed, if you say you went to Harvard, I'm not sure that matters a lot. So to say you went to USC,
if you have a dental license, that's all that matters.
Yeah.
If you can get a license, do it.
Yeah, I totally agree. But yeah, the debt, and it said in here, and this is the Wall Street Journal, said that dental school is the most expensive graduate school right now. I mean, how unbelievably ridiculous is that? And I don't know. I think that with some of these new graduates coming out when they're $350,000 or $400,000 in debt, they've got to take a job at a corporate office or at working as an associate. And right now, maybe you can come out and make $150,000, $175,000 a year. But at what point are they going to start saying, well, we've got tons of graduates coming out. We're not going to pay you $150,000. We're going to pay you $125,000. And then, that's tough to be paying, I don't know, $2,000, $3,000 in student debt every month with that kind of income. It sounds like a lot, but that's tough.
The more debt you're in when you come out of school, the less options you will have.
Yeah.
We've talked about this in the past as well, You're going to have, and unfortunately, maybe that's the situation of this emailer, is the fact that, you don't have another choice. You can't go out to a bank and say, hey, I want another $500,000 and I want to start up a dental practice. They're going to tell you to go jump in a lake. Back when we got out of school, I could have got any amount of money I wanted.
Yeah.
I could have just said, here, I don't even have a job, but I'm a dentist and I have a license. I could have signed the dotted line and they would have given me any amount of money I wanted to do anything I wanted with. Now they're not doing that because they're seeing the problem. Dentists are getting in so deep that they can't get out. I mean, we've heard it. I mean, there's dentists going bankrupt all the time. It happens all the time now. When we got out of school, that was a pretty rare thing. Dentists were almost one of those things. That's why they would give us any amount of money, is because we're a sure give. Man, we'll always pay it back. But dentistry has changed. This 15 years that we've been in, it's definitely changed. I wouldn't, if I came out of school right now, I would really be scared to buy a practice.
I'd be scared to buy a candy bar.
Right?
I think, go.
And that's not good, because most people want to come out and want to be their own boss. We don't want to be in these situations where this person was in, where we have to bark to somebody else's tune, But the reality of it is if you're in, $350,000, $500,000 in debt, what choice do you have?
Mm-hmm.
You're going to go to these corporate offices and they're going to tell you what to do, and you're going to have to say yes, okay, fine, or you won't have a job.
Right. Yeah, and there's not a lot of jobs open with all the new dental graduates because dentists are working later and later into life. I mean, the average retirement age for a dentist in Utah is like 70. Mm-hmm. That's, you didn't go into dentistry to work until you're 70, I don't think. I don't know. I didn't.
I went into dentistry to work till I was 40, and I'm already past that.
And the three of us, I think most people admit we're pretty frugal. We're probably pretty average income for a dentist. We don't have like a real lavish lifestyle. And so, but we still feel stressed about the money. And so coming out of dental school with $1 million in debt or even $500,000 in debt, that is a lot of money. And I think when you go to dental school, you might want to look at which city the dental school is in. I mean, if you're at USC and it's in LA, or the University of Pacific, which is in San Francisco, you're going to pay a heck of a lot for rent, for food, for gas, for everything. And tuition will probably be a little more expensive. You can go to somewhere in the middle of America, pay half as much for rent and things like that, and probably half as much for tuition, and you'll get the same education. So, I don't know. It's something to think about.
Yeah, for sure.
Or maybe the ADA could help out a little bit too, and maybe not let them just keep accepting 5 million dental students every year.
Yeah, I know, and it's a business, and so they're looking to make a buck, and I don't blame them for that. But the reality is, the dental student needs to really start paying attention to this stuff, because, and we've been talking about it ever since we got out of school, and it's just gotten worse and worse and worse.
Yeah.
I mean, it's just like, I don't know how. Getting to a point where it's like, why would you even go into it? Why would you do it?
Yeah,
it's
and college tuition,
it's just too much money.
Yeah, college tuition in general goes up every year. It is one of those things that you just expect it to get more expensive every year, and I don't know, it's one of those things that seems ridiculous to me, because well, I mean, we've already said that why should a dental school professor get a 6% raise or any raise at all if the dentist that he's graduating, he or she is graduating, are taking pay cuts? It doesn't make sense until somebody clues in and thinks, wait, it's going to take like a generation or a few years of dentists, or a decade of of students not applying to dental school and then having a shortage. And until that, nothing's going to change, I don't think. But, they'll keep promising that you'll get out of school and make 6 figures and have this great lifestyle and be your own boss and not work on the weekends. And it's just not true a lot of the time.
Well, you will make 6 figures. That's not hard. The problem is all 6 figures will be going to debt service. I mean, you'll. Yeah, you kind of think it's a joke, but it's for real, huh? We've calculated it out. It's true. To pay back $1 million of debt to get to where you're actually paying it off, you would be eating ramen noodles and hot dogs.
You might be eating your own arm.
Even if you're making 6 figures, even, you know what I'm saying? That you can melt 6 figures away in debt service a year, easy, as a dentist.
Absolutely. And this guy, it said, at $1 million, he should be paying back about a little over $10,000 a month. Okay, so cut that in half, and you're $500,000, or cut it down to whatever you want. You're $400,000 in debt, which is pretty realistic nowadays for a dental student. It's $4,000 a month on average. Yeah. Even if it's $3,000 a month, that is a heck of a lot of money. Right. And I would guess at this point in our careers, we're probably making a little bit more than a new graduate would make, and a $3,000 a month dental student loan payment would be life altering for me.
Oh yeah, absolutely.
So,
absolutely, that's a ton of money.
Yeah. So ramen noodles, here we come.
Yep. And then every year you get the new news that, hey, guess what? We're lowering our fees again. Our insurance companies, or they're raising them. We actually had some raise them by 75 cents.
Oh well, thanks.
That helps.
Yeah, that's awesome. Mm-hmm. Okay, the ADA is working.
Yeah, who knows?
Oh boy,
who knows, man? It's an interesting dynamic we're in, and it's big decision time. It's just a matter of whether, if you really, really want to be a dentist, you just got to be very, very careful.
Yeah, you can't come out thinking you're gonna, drive a Ferrari or something like that, or even like a Mercedes. Well, this guy did.
Yes.
So, that could be a problem too. But, I don't know. Who am I to judge? I'm just delivering the news and giving a very biased opinion on it. So, yeah. Well, you guys have any more thoughts on $1 million in debt?
No, it makes my head spin. Yeah.
Oh my gosh. That is just unreal to me. I don't know. And I remember when we got out of school, and, you'd hear of somebody that had their dental school debt, they'd buy a practice and then buy a house, and boom, you're $1 million in debt. Oh, yeah. And that seems a little more understandable than coming out of dental school $1 million in debt, though. At least you're getting something tangible for it.
Yes. Yeah. I've been well over $1 million in debt.
Yeah.
With those purchases, yes. but not just for school. No, that
Right.
guy was just school, if I'm not mistaken. Correct?
Yeah, school and ortho school, but I mean, at least your practice and your house, at least they're appreciating in value. I would think. Nobody's going to buy your dental school loan.
Nope.
From you.
Nope.
Maybe we should try that.
Yeah, I wonder if they'd do that and say, "Hey, buy my debt."
Yeah. You won't get anything for it, but you can buy it.
All right.
Well, all right, guys. You want to wrap it up there?
Let's do it.
Now that we've brightened everybody's day?
What do we go away for a couple months and listen to us?
My word. Came back a bunch of old codgers.
Well, I blame it on my gallbladder. My gallbladder kept me happy. I don't have a gallbladder anymore because I had surgery.
Tell us about that, Troy. Troy had a little medical emergency.
Yeah, the stress from dentistry caused my gallbladder to explode.
Yeah.
I'm just kidding. It's probably all the fats I eat.
Dang.
I won't be eating any fatty foods. Well, not as much anyway. I need to alter that.
Tone it down a little bit.
Yeah. I like to blame dentistry on everything.
I would too. So thanks for joining us. We really appreciate it. We appreciate all our listeners, and we will see you on episode 31 next time.